Our guest today from New Delhi, India, is Dr. Chandrakant Lahariya. Dr. Lahariya is an Indian medical doctor, epidemiologist, vaccinologist, public health authority, and author. His work centers around strengthening health systems, public policy interventions to address health inequities, and developing innovative models for the health service delivery. He is the lead author of the book Till We Win, India's Fight Against the COVID-19 Pandemic. Dr. Lahariya has coordinated the World Health Organization's work on new vaccine introduction in India, and he has worked on the formulation of the national vaccine policy of India. Follow Dr. Lahariya on Twitter at Dr. Lahariya. So that is at Mark DRLAHARIYA. His Twitter feed contains helpful updates on the unfolding COVID situation in India and worldwide. We have Dr. Lahariya here today to provide the latest with COVID in India and what this means for global public health. Dr. Lahariya, thank you for taking the time.
Dr. Govard, thank you very much for inviting me, and pleasure is entirely mine to be with the audience and you.
Well, in recent weeks, we've read in the news about the current wave of COVID in India and all of the suffering it has caused. Where do things stand today with the pandemic, and which regions of India are most affected?
So, starting April until mid of the May, India reported a high number of COVID-19 cases. The daily number of COVID-19 cases crossed 400,000 a day. However, the number are coming down now, and we have seen 100,000 plus cases last few days. So this is definitely a decline. What we have also noticed that the pandemic has moved from the northern part of the country toward the southern parts of the country. While a number of new cases, daily new cases have come down in the major cities such as Delhi, Mumbai, and even North Indian states such as Madhya Pradesh, Uttar Pradesh, Rajasthan. We had seen a test positivity rate of up to 25 to 30% for a few days in the city, which has come down to around 2% or 1% in cities such as Delhi. So there is definitely reasonable and significant decline in number of new cases. Number of new cases have come down to a few hundred in cities like Delhi, a few thousand in Mumbai, and which is a manifold reduction. However, we also know that the pandemic has moved towards southern part of the country. The number of daily new cases are relatively high in southern Indian states such as Kerala, Tamil Nadu, and decline in not as much as we have seen in North Indian states. The pandemic has moved to a northeastern Indian states, which are reporting relatively more cases than earlier, though the overall number of cases is less, but still the trend is upward. One of the key areas which we need to remember is that the proportion of testing in rural India is relatively less. So we really don't know the full picture in rural India. But going by the trend and going by the people attending healthcare providers, even in the rural North India, number of cases are coming down. So we are optimistic. The number of cases are still high. They are far higher than the number of daily new cases at the peak of previous wave, which reported 97,000 cases in a day at the peak of first wave in September. Currently, we are around 130,000. However, situation seems to be under control and the trend is declining. We hope that it will continue to decline, and there will be a flattening of the curve in coming days or weeks.
There were many reports in the news about shortages of medical oxygen for COVID patients in India. We understand that international aid has been delivered. Do healthcare facilities in India now have enough oxygen supplies and hospital beds?
So this need to be put in the context that before COVID-19 pandemic, India was utilizing around 900 metric ton of oxygen every single day, while the country had an overall production capacity of combined oxygen, which included industrial oxygen or medical oxygen, around 8,000 metric ton a day. So India as a whole had a high production capacity for both medical and industrial oxygen. 900,000, my apology, 900 metric ton a day for medical purpose, and then there was additional capacity of 7,000 metric ton in total. At the peak of first wave, the medical oxygen requirement increased by threefold, which was around 2,700 to 3,000 metric ton a day, which was still available and sufficient. However, we know that in the second wave, the number of cases gone up by fourfold. One side, there were 100,000 cases in a day in the first wave. The number of cases in the second wave was 400,000 in a day approximately, which essentially meant that the proportion or amount of oxygen needed was increased manifold, and it became a real challenge that medical oxygen was not immediately available. There was another challenge of distribution, that while medical oxygen at a national level as a whole was available in the country, however, there were few states which do not have a local production capacity for medical oxygen. As an example, what we were hearing, that Delhi required a lot of medical oxygen, but had no local level production capacity for medical oxygen. So most of the oxygen need to be transported, and there were challenges related to the cryogenic tankers and the transport and other aspects. So definitely it become a situation where medical oxygen need to be transported from 2,000 kilometers away to Delhi to fulfill the requirement. And that resulted in the kind of crisis we have heard and seen in the past. However, we know that now number of cases have come down to 1/4 of what was at the peak. So the medical oxygen requirement has also come down. The systems and mechanisms created are now functional and in place. And the oxygen concentrators, the local plants have been set up. So things have improved, and we hope that there would not be that kind of a surge in the future. But definitely the preparedness is far better and situation is under control. India had capacity to supply or produce medical oxygen. It became a crisis because in the shorter period, it needed a far higher quantity at a different places. So it was about production and distribution both. Situation are under control in medical oxygen, and rather those eased out a few weeks ago. However, we also need to remember that this was taken a note by Supreme Court of India, which has set up a national task force to examine the oxygen supply in the country, which would be looking into this matter in the long run and would be providing its recommendation on supply of medical oxygen and other aspects of pandemic response.
Which vaccines has India procured to fight COVID, and how many total doses will India need?
So India is currently utilizing two vaccines. One is Oxford AstraZeneca vaccine, which is called Covishield in the country. This is produced by Bharat Serum Institute of India. And there is another vaccine, Covaxin, which is produced by Bharat Biotech. It's an indigenously developed vaccine. The third vaccine is Sputnik V, developed in Russia, is also available and soon will be rolled out. So 3 vaccines are already licensed and scheduled to be rolled out. We know that till the month of May 2021, the total production capacity of the 2 vaccines was 200. Total production capacity of the 2 vaccines was around 60 to 80 million doses a month. However, now in the June, the production capacity has gone up to 80 million shots a month and likely to go up to 120 million a month. So this is slowly increasing. The government of India has projected that between August to December 2021, the country would have a total 2.16 billion shots of different vaccines. So these vaccines are production capacities are being increased. At the same time, we know that India originally planned to have 600 million shots administered, which was 300 million people being vaccinated by July 2021. However, in April 2021, the country allowed the vaccination of all adult population, entire adult population, which meant essentially India allowed India by doing vaccination of everyone who was 45 years plus till 30th April. However, starting 1st May, India started vaccination of 18 years to 44 years. Now here we need to remember the numbers. The population which is 45 years plus, including health workers, are around 330 million in the country. However, with opening up for adult population of 18 to 44 years, the additional 600 million population became eligible for vaccine. Essentially, it increased the total target beneficiary to around 940 million. Now, each of them need 2 shots, which essentially means approximately 1.88 billion shots required. So one side, you have a vaccine requirement of 1.88 billion, while the monthly production capacity is 80 million shots, which is likely to go to 120 million. So there is a large gap between supply and demand, and that has been the challenge. And that's why we are hearing many challenges in people getting vaccinated. There are more dimensions to this. The vaccine delivery has been liberalized as per the new policy starting 1st May 2021, which essentially means now vaccines are available at 3 different prices. Central government gets vaccine at different price, state government have to purchase their vaccine for 18 to 44 years, and a private sector has a different price, and which has also created a big challenge in securing vaccine and the availability of vaccines. So there have been a few challenges in vaccine procurement, supply, and delivery in India. The demand is far higher than the current production capacity.
So India and the US are sister democracies. We're also both federal systems. If I understand what you just said earlier, there have been occasions when the national government has been purchasing vaccines, and there have also been occasions when the state governments have been purchasing the vaccines, as well as the private sector. Are we moving into a phase where the vaccine procurement will be handled only by the national government, or will there continue to be this three-pronged approach to vaccine procurement?
So there has been a lot of discussion, including the political leaders and technical experts, who have suggested that the vaccine procurement process need to be streamlined. Though there have been argument that there should be a single price for the entire nation, there has been argument that a central government or national government should be purchasing vaccine and providing to the state government. There are also arguments that in the mid of the pandemic, the vaccines should be free for every citizen. So all of these arguments have been made. However, it does not seem that there would be any change on the cost of vaccine. However, experts and state governments are arguing that the bare minimum the union government should do have a single purchaser mechanism where they, on behalf of state government, start a single global tender and start buying for state government. And that will ensure that the central government will have the bargaining power over the vaccine manufacturers. As a single large tender, they can nudge the vaccine manufacturers, some of which declined to sell vaccine to the state government because they were asking for lower quantity. However, argument is that if national government as a single purchaser start buying, one, they can get a better rate or cost of the vaccine, but also can nudge the vaccine manufacturers to consider the proposal. As an example, we were hearing before or earlier that Pfizer BioNTech does not have any spare capacity for entire 2021, and it was believed that India may not get any vaccine from Pfizer BioNTech. However, when Union government started the dialogue with the Pfizer BioNTech, we now know that there is a possibility that 50 million shots of that vaccine could be available for India starting October 2021. So those discussions are going on. We really don't know what will be the final outcome. However, it is clear that the state governments do not have that kind of capacity, the capacity and experience to purchase vaccines directly from the manufacturers. It is also known that when there are limited number of manufacturers, which are 2 in India within country, and there are 35 or 36 state governments or union territories, then when there are more buyers than the sellers, which essentially would mean that each of the state government would end up higher price than what central government can secure the vaccine. And essentially, even if it's coming from the state governments, which have to pay a higher price, ultimately it's government money. So government would end up paying far higher price for the vaccines than a single purchaser can do, and that would be inefficient. So there are many economic, political, logistic, operational arguments being made to reconsider some aspects of the policy. And we can hope that some of the development which would favor or streamline the process would take place in coming weeks or even days.
Now, for the sake of our audience who may not be familiar, the world's largest vaccine manufacturer is in India. It's located in Pune in the state of Maharashtra. It's called the Serum Institute of India. Amid India's COVID outbreak, the institute's operations were hampered due to raw materials shortages, and in April, it stopped the production of COVID vaccines for export to other countries due to orders by the Indian government. Doctor, what is the latest status with vaccine production by the Serum Institute?
So, as far as I know, the vaccine production was not hampered. However, what happened that when the second wave emerged in the country, and before the second wave, India, as part of vaccine maitri or vaccine friendship, was exporting vaccine to a number of other countries. India had actually exported or supplied or donated in one or other form around 65 million doses of various vaccines to more than 90 countries till April 2021. However, with the surge in the cases and second wave, Indian government had put a temporary halt on export of the vaccine. However, the production of vaccine at the Serum Institute of India continued as earlier. We also know that Serum Institute of India is one of the largest vaccine manufacturer by volume. However, it had planned the expansion of COVID-19 vaccine, which is Covishield, the brand name, to around 100 million shots a month by January 2021. Yet, with all the efforts, the vaccine production was hovering around 60 to 65 million shots a month. So the production capacity was less, but it was due to various other factors. But at no point of time, to my knowledge, the vaccine production was halted. Yes, there was a temporary ban on export because the country needed a far more quantity and there was a higher demand. There were people who were returning from healthcare facility or vaccination centers who wanted to get vaccinated. In late April, some of the vaccination centers had to be temporarily closed or were not functional because vaccines were not available within the country.
Today, the Biden administration committed to supplying India with 25 million COVID vaccines. This after a recent announcement by the White House a few weeks back that the US will provide India with raw materials for vaccines, oxygen equipment, PPE, and various medical supplies. Doctor, does New Delhi think that the White House's response has been sufficient?
I think one of the things which is very clear in this COVID-19 pandemic response that countries have to fight this virus through solidarity and collaboration and working together. At some point of time, India was exporting vaccine, but then it had its own challenges. When there was a crisis in India, United States government and many other governments came up with their own offers to provide oxygen cylinders, PPE, concentrator, or whatever, even the vaccine raw material. One of the key development, key challenge for India in scaling up of vaccine production was raw material, a large proportion of which comes from United States of America. So with the second wave and the dialogue between two countries, Biden administration had definitely helped on various components, including ensuring the sustained supply of vaccine raw material. I think in global response, more important is solidarity and willingness to collaborate and work together. Whatever comes is really useful, but it should be seen that what kind of mechanism or engagement we are setting up, and it's really positive development I see between India and United States and in this second wave and in general COVID-19 pandemic response. I specifically want to flag that the challenges which emerged has also meant or resulted in a few good development. One of those is that a few weeks before second wave in India, the quadrilateral security dialogue, which is a collaboration of 4 countries, India, United States, Japan, and Australia, had already worked, and they had discussed that the vaccine development collaboration would be established. Vaccine supply and collaboration between United States companies and Indian manufacturers were discussed. But the timeline for those collaboration was somewhere around late 2022. With this kind of challenge and renewed understanding and renewed dialogue, we see that those collaboration timelines have been preponed, and now we see earlier timelines and collaboration. And these are some of the things which will be really long lasting. Similarly, I want to flag that the US has taken stand where it is more willing and open to support the TRIPS waivers for COVID-19 vaccines. Is a major shift in the policy for the US government, and also which has a potential to increase vaccines availability for rest of the world. So some of these developments are really good. Of course, in any collaboration and dialogue, there is always scope for more, but we should also appreciate what has been done and in direction which it's going, which is really promising.
In what areas does India need to scale up capacity to fight the pandemic?
I think what need to be understood that no country is fully prepared for pandemics, or at least not to the pandemic of this extent. However, we also need to understand that often countries focus or pay too much attention or far too much attention or excessive attention on medical services, and they largely forget the public health services, the disease surveillance, the data recording and reporting, and those mechanisms are not there, which are so very essential for pandemic response. Because unless you have data and information that what is happening, where it is happening, it is going to be a challenge. India has made a reasonable progress, which is really sufficient and commendable in a production of PPE, also in the expansion of testing capacity. The hospital beds were also increased. However, what we need to remember that the pandemics require that you have some of the urgent requirements, and so you have a temporary facility. But unless countries start utilizing that challenge to build something long-term, which can be sustained. For example, for the first wave, India had set up many temporary large COVID care facilities, which were even dismantled by February 2021. And then when second wave came in April 2021, those facilities were not available. That should not be the approach. There is a big learning for all the country that you need to have a health workforce available across the country. You need to build system which will be long lasting and not ad hoc or temporary. So India definitely need to strengthen its healthcare system. It need to the government in India need to increase investment on health services. But it's not enough that those investments are increased. It's important that those investments are the right place. For example, standing of primary healthcare centers. India has a 70% rural population. Now, it has some of the facilities, but those need to be made functional. As an example, for the wider audience, I would like to share that India has nearly 30,000 primary healthcare centers in rural India. Now, each of those 30,000 PHC have 6 beds, but at times those 6 beds which are supposed to admit patients are not utilized. Now, taking this pandemic as a clue, it could be worthwhile that those beds are made functional, those vacancies are filled, and the oxygen cylinders are supplied on for those beds, for those facilities. That way, country can have 180,000 oxygenated beds. But that require that many cylinders or a good number of cylinders available. That requires that local level oxygen production capacity there. But that would not be enough. It requires that we link it with the surveillance system. We strengthen community linkage with the program. So there are a number of areas and challenges which have been identified. It is also being recognized that this should not be temporary, but the mechanism should be done with a detailed roadmap which provide what will be done in the 6 months, what will be done in the 2 years, and what will be done in the 5 years. With this pandemic, not only India, every country need to derive lessons and prepare for itself for a future pandemic, but also prepare itself to deliver better healthcare services than it was delivering before pandemic period. And it's challenge for India, it's challenge for many low and middle income countries, and probably for other countries. There are countries which have a good medical care infrastructure. Possibly they need to examine what they can do in public health services. But all countries need to do something. India probably need to do little more, especially on primary healthcare, on public healthcare services, and also increasing the government funding on health.
What can you tell us about the COVID variant, I believe is called B16171, that we're told originated in India? Do the Moderna, Pfizer, Sputnik, AstraZeneca jabs, as well as India's indigenous jab, do they adequately protect against this variant?
So we know that there have been a new variants in of ancestral SARS-CoV-2. The variant which originated or which was first reported from India, B1617, now classified as Delta variant. World Health Organization has given different names to these variants. So the Delta variant is the most common variant in India. The genomic sequencing and other data which has been found, which has been collected in India, and only yesterday there was a paper based upon that, which indicate that this Delta variant is far more transmissible than Alpha variant, which originally reported in United Kingdom. It might have some immune escape also. So there are some early studies which are coming up. So what we know that initially the variant was tested, or the vaccines, available vaccines, especially Covishield and Covaxin, were tested for potential of immune escape, and it was found that they are very similar efficacy against these variants. But as we know that this is an evolving situation and we need to continuously examine those settings. To my knowledge, I am not sure if that kind of analysis has been done, whether these vaccines would be the Pfizer-BioNTech or Moderna vaccines would be, what kind of efficacy they would show against this variant. As far as broader principles are concerned, other than variant which originated in South Africa, and wherever studies have been done, there might be little reduction in efficacy, but it is unlikely that vaccine would not be effective. Considering the vaccines already have a efficacy in the range of 80 to 95%, so variant might have some differences and efficacy might be slightly lower for these vaccines, but there is no reason to believe, at least as of now, that it would be far lower than the threshold of 50%. So, we really don't know conclusively yet, but this is an area which we need to continuously follow and understand, because this is about one particular variant, but also about future variants which would be coming, and that's an area where we need to continuously working and examining.
We've seen reports how some COVID survivors in India tragically end up dying from a fungal disease called mucomycosis, I believe it's pronounced. Can you tell us anything about this infection, its prevalence, and if it's contagious?
So it is known that starting 1st May or starting early May, a fungal infection was reported from number of COVID-19 cases, especially 3 group of COVID-19 cases. One, those who were on the long-term steroid therapy. Second, of those who were uncontrolled diabetic, which means that they had a diabetes which was not under control. And third, who were immunocompromised, either primary immunodeficiency or due to other medication or other reason they had some deficient immunity. So these 3 group of people were reported a fungal infection, which was wrongly named as black fungus. I'll repeat this part so you can add it.
Oh, it's fine.
So some of these people, these three group of people were reported a new fungal infection, which was initially and wrongly termed as black fungus. Later on, it was identified as mucormycosis. It's a different group of fungus. We know that while between starting April 2021 to 31st May 2021, India has reported 16 million new COVID-19 cases. However, the number of the fungal infection is around 15 to 18,000. So while the cases have been reported, but these are a very small fraction of overall COVID-19 cases. They are mostly in the moderate to severe disease patients. We know that this condition is relatively serious, like any other secondary infection which happens in COVID-19. There is a reported mortality of around 50% in these cases. So early identification and early treatment is the key. But I also want to share that with the decline in the COVID-19 cases and with the better recognition and understanding of challenges, what I'm hearing that number of new cases of mucormycosis has come down.
May I ask, what are the symptoms and warning signs of mucomycosis, and what areas of the body does it affect?
So the common symptoms of mucormycosis, we start with the fever and then headache and cough and pain, pain in and around the nose and eye. So red eye is also there, but we know that this mucormycosis fungus is which affect sinuses and nose, sinuses in the face and nose. So it starts with the nasal blackish discharge, but it can also affect mouth and palate, which also can mean loosening of teeth. But since it affects sinuses, so it can go to the brain, so a person can have an altered mental status. And it can also affect lungs. So anything which is linked to virus or all the parts which are related to face and nose and eyes and head, brain and lungs are affected. The common symptoms are often cannot be differentiated, but what people need to know some of the warning signals which it has. So for example, a blackish discoloration in and around the nose and the base of nose and eyes is a really concerning sign. Similarly, if there is a blackish discoloration on the palate or the loosening of teeth, so these are some of the warning signs. Also, if there is a nasal blockage and congestion with some of the blackish discharge, local pain in the cheekbone, so these are the signs which one should be worried. The red eye or the blurring of vision, those are also the sign of this mucormycosis cases. Then if it goes to the lungs, it can cause chest pain, breathlessness, it can result in bloody vomiting, and the respiratory symptoms can worsen. And if it reaches to brain, then it can result in altered mental status, confusion, people forgetting things. So there are a wide range of symptoms which can happen depending upon which part of the body is affected. So the key is that a moderate to severe COVID-19 case, and especially those the three high risk factors of uncontrolled diabetes mellitus, those with the immunocompromised status, or those with the long-term steroid therapy. I'm saying these repeatedly because people need to know these parts. So these three group of people need to be little alert. If they see any blackish discoloration on the base of the nose and close to the eye, red eye or blurring of the vision, blackish discharge from the nose, a black mark on palate, loosening of teeth, so they should immediately contact healthcare provider. In mucormycosis cases, key the early identification. If the treatment is started early, the chances of recovery are really better than otherwise. The mortality is high. Sometimes if eyes are affected or particular organ is affected, the debridation or complete removal of that part of organ is another challenge. So people need to be aware. But I also want to highlight that it should not cause any panic, because it's only a smaller fraction of people who develop mucormycosis. It's not a contagious disease, which essentially means that if somebody who has mucormycosis cannot pass on it to other person who is standing or close by. The person get mucormycosis because his or her immune system or immune status is really poor, but he or she cannot transmit to another person who is standing close by, or it's not like a COVID-19 which transmitted through respiratory droplets or airborne mode. This mucormycosis, this fungi is all around us. It's found on the damp walls, the fallen leaves at the construction sites. Like, it's all around us. It just does not make people sick that frequently, unless there is some specific situation such as COVID-19 and reduced immunity and many other factors.
Okay. Doctor, how are India's South Asian neighbors coping with COVID-19, in particular countries like Nepal, Bhutan, Pakistan, and Bangladesh? Are you familiar with how those societies are affected?
What one is realizing, and every country is realizing, that there is no victory in this pandemic in any setup till entire world wins against the pandemic. We have witnessed that while majority of the countries had only one wave or two waves, but a few countries reported 3 or 4 waves, the United States, UK, India reported second wave, and there are a few countries like Thailand and other had only reported one wave of Vietnam. But now in the last 2-3 months, we have seen that even those countries which were relatively successful have seen a second wave, though a smaller one, but rise in the cases. So what we are experiencing, and even from the China, we have heard a few more reports that cases have been coming, that as long as virus is around, we cannot be complacent and sit down. So when India reported second wave, around the same time, the number of cases had increased in Nepal, Pakistan, Sri Lanka. All other countries have reported this virus is in all those settings. It follows a particular pattern. Unless specific measures are done, unless health system is ready, unless disease surveillance system is really functional, efficient, and identify early signal, the virus will come back. Or the alternative way that we need to vaccinate people so they develop immunity, and then the transmission is reduced. But as long as virus is around, as long as it's circulating, it will also mutate and may result in the new strains, which can transmit very differently than the previous strains or ongoing strains. So all of the countries have reported increase or a new surge in the cases, especially in Southeast Asia. So all of these countries have reported new cases and surge, though it has varied from one part to other part. But we know that this is not just any other virus or any other disease. This is a pandemic. Entire world is at risk till virus is circulating in any part of the world. We have seen that one particular strain found in one country is soon reported from many other countries, even when there is a restriction on the travel and other restriction. So we need to be really careful, and we need to be aware about these challenges. And we should be aware about what is happening within our country, within our neighbors, and in the rest of the world.
How should we be modeling these epidemics to make reliable projections? And more broadly, what are the lessons we can learn from COVID to best prepare for the next pandemic?
So the key on the modeling is that modeling is a very important tool to forecast the preparedness, the various resource requirement, and how the virus will unfold or evolve over a period of time, but also how health systems can be ready, what kind of human resources, infrastructure would be needed. But we also need to be mindful that these modeling are dependent upon a number of assumptions. They are also dependent upon the quality of data which is available to feed into those models. And we know that every country has a different level of data granularity, which makes it really difficult to project anything more reliable. So the estimates are always very challenging. Moreover, we also know that modeling comes with different type of scenario. So when when a model fails in its projection, it can also mean that the public health intervention, which should have been done, have been implemented really well, because the failure of model will come with the success of correct public health interventions. So these are important tools in a disease, on the pandemic response or outbreak or epidemic response. What we can learn, there are many learnings from it. But as I said earlier, that we need to remember that all the learnings will be considered at the end of pandemic. But key highlights are, I would like to say that we need to prepare for future pandemics. You cannot fight pandemic when it comes upon you. So that's one. Secondly, you need a stronger primary healthcare system. You need a better data recording reporting system. You need a disease surveillance system. You need to collaborate and show solidarity to others. I just want to give an example of importance of pandemic preparedness. Today, the world has around a dozen COVID-19 vaccines being utilized in different parts of the world. Now, these vaccines could be developed at the fastest pace within like 12 to 15 months in a period which was a pandemic period. Before this, the fastest vaccine which were developed over 4 years. Why this could happen? This could happen because the world had thought of a collaboration called Coalition for Epidemic Preparedness and Innovations, CEPI. This was set up in 2017, and global community thought that something need to be done in this area, and this facilitated and supported COVID-19 vaccines. So that's the power of collaboration and engagement and planning in advance that we can do. So one of the key learning is that the world is every passing day, world is closer to the next pandemic or next disease outbreak. It's happening because of the climate change, deforestation, urbanization, overcrowding, single battery farming, antimicrobial resistance. There are many ingredients which are contributing that today we are closer to next pandemic than yesterday we were. So that's the kind of situation that the only solution is right and effective coordinated planning. And that planning need to happen at the local level, national level, and global level. It requires collaboration. So many learnings, and of course, there are many wise people and learned people and experts who will come up with learning. We need to use the combined understanding and knowledge to fight and prepare for next pandemic.
Also, your book, Till We Win. You and your co-authors must have written that book very quickly, because the book addresses the current COVID-19 pandemic. When did you begin writing it, and how long did it take to complete?
Let me tell you that why we decided to write the book. So along with me, it has Dr. Randeep Guleria, who is India's leading strategist on COVID-19 pandemic response. He works with government, and he's the director of India's leading medical research institute, All India Institute of Medical Science. The other co-author is Dr. Gagandeep Kang. She's a world-renowned vaccine expert and virologist. She was heading an institute, and now she works at another reputed institute. So in the early part of pandemic, there was a lot of discourse about, or rather misinformation about the virus. And we realized, all three of us are passionate about science communication. We realized that this misinformation is going to be a big challenge. And it is not enough that we tell people that you should wear face mask or you should wash hands, but they should also be empowered with the knowledge that why they should be doing that. Alongside these people need to be shared the information about the virus, how it spread, and related aspects, the vaccines which were likely to come, and medication. So the entire idea of writing the book was fighting the misinformation or infodemic, but also empowering people and family members to understand the virus and respond to the pandemic. We wanted to engage them in the fighting pandemic. But there is another reason, and which is very personal to me, and that is India was having a detailed and long deliberation in the first part of pandemic that Indian healthcare system need to be strengthened. And then I thought, and I discussed with my co-authors, that this is, though there is a lot of discussion on strengthening India's healthcare system, but understanding of health system was limited or incomplete. When talking about healthcare system, all it was focused upon increasing testing capacity, increasing hospital beds, while technical experts know that this is important but not enough. You want to strengthen health system, you need to do more. So we wanted to write a book which will provide a reasonable understanding to political leaders and general readers what health system strengthening is, what all need to be done so India's healthcare system can be strengthened. And we wanted to tell this message to general reader because we thought that it might bring, especially in the context of COVID-19, where there's an interest in understanding those aspects, it might bring some sort of accountability from general public to political leaders that, okay, you are talking about health system spending, but what you are doing is not health system spending. To achieve health system spending, you need to do all this. With all this, we were busy. All three of us were very busy in our work and pandemic response. But we also realized and recognized that if something needs to be done, it had to be done and time had to be found. So we started writing in April and or May, mid of May. It took longer time because we were utilizing our spare time, but we could finish writing by August and mid-September. And we are thankful to publisher who could also brought up the book very quickly. And so it was a coordinated effort while we put some extra effort, extra time, and publisher also facilitated that in a period of exactly from a concept to release in the market, it took nearly 6 months.
It's an extraordinary accomplishment, very important one, and thank you for your contribution.
Thank you.
So to wrap things up, a few last questions. I want to be mindful of your time. Can you recommend any news sources on the COVID situation in India that we should be following?
So there are a number of official websites which provide current situation of COVID-19 in India. So Ministry of Health and Family Welfare, Government of India provides official data on number of new cases, number of daily cases, also vaccination status. So that is one very reliable one. Then there is an Indian Council of Medical Research. You can, viewers can Google it, Indian Council of Medical Research, which is the leading research agency under Ministry of Health and Family Welfare, which provide information mostly on testing services because they coordinate testing services. But I also think that there are a number of policy think tanks and even newspapers which run their own COVID-19 dashboard. And I don't want to be unfair to anyone by naming just one. So I would say that there are Indian newspapers and policy think tanks which have a COVID-19 dashboard. It's always useful. That's what I do, and that we should look for multiple data sources to get a complete picture rather than one. But government websites, mohfw.nic.in and Indian Council of Medical Research, icmr.gov.in, they can be found on Google, are official sources. And there are newspapers and policy think tanks which have their own dashboard, which should be looked at.
Oh, good. That's very helpful. In addition to your commentary each day, I know that you write often. What other projects are you currently working on? And do you have any plans in the works for a new book?
Thank you. So that's a very good question. So what I did, I realized that in India, the pandemic required some critical reflection and some independent voices. I was involved in a regular job, but I thought I had been long argued. I was continuously arguing that pandemic required independent expertise and voicing. So I made a decision myself. I decided to take a sabbatical from work. And now I'm working full-time in my personal capacity as an independent voice to critically reflect and write, and that's why I write a lot, and that's why that's what I want to contribute without being biased or influenced by any source, and say things which I believe are the right. They may not be the only solution, but I believe with my understanding those are right. So that's the kind of work I'm doing. I critically analyze, review articles, but review various situations, and that's my time is going on. But I must also tell you that while I critically review and critique government policies, but unlike many people believe that if I criticize them, my voice is not heard, or I'm not. I often invited to government high-level discussions to provide those kind of critique in those meetings. So that's a lot of my time goes into actually looking into the data, providing writing critical aspect, and sharing with the officials and the teams which are working COVID-19 response in the government in India. The book, of course, I would write another book, and in a different flavor, documenting or critically reviewing India's pandemic response. However, that is not immediate priority, because immediately, as countries in the second wave and as countries preparing for third wave, I want to utilize my time to provide some inputs and guidance. And of course, the book can wait. As I said earlier, that the learning or lessons would be at the end of the pandemic. Of course, anything which I'm doing will contribute to my book. There will be a book, but I've not started thinking or writing about it yet. But I'll definitely let you know and keep you posted when I start writing and once it's out.
Please do. Our guest today has been renowned epidemiologist and author, Dr. Chandrakant Lahariya. Doctor, what a pleasure. I'm really grateful that you gave me a bit of your time today to provide these important COVID updates, especially given everything that you have going on. It's been a pleasure having you with us, and we'll check in again with you soon.
Thank you very much. I really enjoyed this conversation. Thank you so much.
Thank you. All the best.